Epidemiology. Breast cancer is the commonest malignancy in the women and comprises about 18% of all female cancers, with 1 million new cases in the world each year. In the United Kingdom, the incidence among women aged 50 approached 2 per 1,000 women per year. Risk factors of breast cancer. It's more common in a female gender more than male gender. If there is a previous personal history of breast cancer, family history of breast cancer, first-degree relatives, early menarche less than 12 years of age, late menopause more than 55 years old of age, late first pregnancy more than 30 years old, or no pregnancy, advancing age, long-term use of hormonal replacement therapy, benign breast condition like atypical hyperplasia. The pathophysiology of breast cancer. There are 3 important ways of breast cancer growth. First one, by a damaged cell. When a cell DNA is damaged, mutated cells begin to rapidly reproduce, then aggressive cells growth can form a tumor that does not function as a normal cells. The second way, by accelerated growth. Cancer cell growth is often fueled by normally healthy chemicals of the body, like estrogen, progesterone, and the growth hormone. When a cell becomes cancerous, these chemicals can accelerate the growth of breast cancer tumors. The third way, by the lymph system. Lymph node and blood vessels can carry the cancer to other areas of the body. Origin of the growth of the cancer cells, which is almost always in the lobes, lobules, or ducts. When a cancer is found in the nearby lymph nodes, it helps doctors to identify just how far the cancer had spread. Signs and symptoms. The patient can come with breast mass. A dominant mass is a distinct mass that is asymmetric with the other breast. Nipple discharge. Mastalgia, which is mean breast pain. Bone metastasis. Liver and peritoneal metastasis. Metastatic disease to the lungs. And a brain metastasis. Stages of breast cancer. There are 4 stages of breast cancer as the following. Stage 0 and 1. These lowest numbered stages represent the earliest detection of breast cancer development. At stage 0 and 1, the cancer cells are confined to a very limited area. Stage 2 of breast cancer is still the earlier stages, but there is evidence that the cancer has begun to spread or grow. it is still contained to the breast area and it is generally very effectively treated. Stage 3 of a breast cancer is considered advanced cancer with the evidence of cancer invading surrounding tissue near the breast. The last stage, stage 4 of a breast cancer, it indicates that the cancer has spread beyond the breast to other areas of the body. Diagnosis of a breast cancer. We diagnose a breast cancer first by history and physical examination. An exam of the body to check a general sign of health, including checking for the sign of the disease. Clinical breast exam, an exam of the breast by a doctor or other health professional. Mammogram, an X-ray of the breast. Car biopsy, the removal of tissue using white needle. Biopsy, the removal of cells or tissues so they can be viewed under microscope by a pathologist to check for a sign of the cancer. If a lump in the breast is found, a biopsy may be done. Prognosis of a breast cancer. Evaluative prognostic factors are very important to help determine patient's treatment. Prognostic factors such as size of the tumor and lymph node status. Large tumor size lead to worse prognosis than smaller tumor size, and the presence of the disease in the lymph node lead to the worse prognosis than disease-negative nodes. Determination of a prognostic factor can be done by pathologic testing of the breast tumor such as ER, PR, and HER2 status. Tumors that are ER or PR positive tend to denote a slower growing indolent disease and have a more favorable prognosis than ER, PR negative disease. Tumors that are HER2 positive generally denote a more aggressive disease that can be determined by the two different methods, immunohistochemistry or fluorescent in situ hybridization. Treatment of a breast cancer. Nowadays, modified radical mastectomy is used to remove the entire breast along with an axillary lymph node without dissection of pectoralis muscle. This approach leads to equivalent survival compared with a radical surgery that used many years ago. Indication for surgery and radical mastectomy. 1. Tumor is greater than 5 cm in size. 2. Patient has a greater than 4 lymph node disease or a tissue margins were present after surgery. Note that not all patients are candidates for this procedure. According to the National Comprehensive Cancer Network provides the treatment guidelines to help guide treatment planning. The following chart summarizes the algorithm of a treatment. Patient come with a tumor. If a tumor greater than 1 cm, treated with a systemic chemotherapy. Plus, patient with ER and PR positive, this is treated with hormonal therapy. If a tumor is smaller, 0.6 to 1 cm, and a negative lymph node, poor prognostic feature, tumor with lymphatic invasion, high nuclear grade, hormone receptor negative, or HER2 negative. Those need chemotherapy with or without trastuzumab therapy. Favorable prognostic feature, hormonal positive disease, need hormonal therapy without chemotherapy. Adjuvant chemotherapy. Many different combination chemotherapy regimens are used in the adjuvant such as anthracycline containing regimen are commonly used, doxorubicin or epirubicin in a combination with an alkylating agent, cyclophosphamide plus or minus fluorouracil are a typical regimen.